military staff.
A medical emergency is something that no one wants to deal with, yet it's something we all need to be prepared for. Each year in America, thousands of people face emergency situations with their family or loved ones. And tragically, many lives are lost because people have not taken the time to learn a few simple techniques that could mean the difference between life and death. The procedures you're about to learn are intended for those first few critical moments after an accident occurs and before professional help arrives. While there's no substitute for trained professional help, the lessons you're about to learn could save your life or that of a loved one. Before we begin, it's important to keep a few basic principles in mind. The first being attitude. When faced with an emergency situation, the initial reaction is to panic. You may want to run away, or you could be shocked into freezing like a statue. Don't worry, this is a normal response. A life or death situation can be overwhelming at first. Remember, the proper preparation for medical emergencies involves understanding the principles behind the procedures. Once this is accomplished, you will avoid the urge to panic because you will understand what needs to be done and will immediately put those procedures into practice, like any police officer or other emergency personnel. In the final analysis, how you deal with a medical emergency is directly related to your training. That's why this tape should be used as a way to arm yourself with the facts and procedures you may someday need to save a life. Let's start by seeing just how safe your home is.
Accident prevention is something every family should review. To make your home a safer place in which to live, make sure that all of your medicines are in bottles with child-proof caps. If there is a significant amount of prescription drugs or a number of small children in your home, then a locked cabinet should be considered. Be sure to discard any outdated medication as soon as possible. You should also keep an adequately stocked first aid kit on hand at all times. Curtail the possibility of bathing accidents by applying safety grips on all tubs and shower floors. Clean out all non-essential cleaning agents and other products from under your sink. If there are any small children around, you should remove any dangerous agents and store them out of reach. Keep all knives and other sharp kitchen utensils stored properly. Keep cleaning agents, poisons, and weed killers tightly capped and properly stored. Paint and paint thinner should be capped and out of reach of children. Be sure to properly dispose of all outdated paints and poisons. Dangerous implements like saws and power tools should be unplugged and kept where children cannot get to them. Be prepared for roadside emergencies by keeping a blanket, first aid kit, emergency flares, and a supply of fresh drinking water in your trunk.
As I stated earlier, being prepared to face an emergency situation requires knowing how to override your initial fears and then being able to automatically act in a proper manner. This thought process is known as ACT. Begin by assessing the situation for immediate danger. Check to see if the victim is in immediate danger from things like fire or shifting terrain. If the situation appears to be secure, then you should immediately call for help. If an EMS system operates where you live, you should access the system immediately. Whenever you believe that a life-threatening or limb-threatening emergency is taking place. For some acute emergencies, definitive medical treatment is the only cure. In some situations, however, you may be outside the reasonable response time of the nearest EMS system. You may have no means of communication, or you may have already dispatched the system. What you do now, prior to the arrival, is critical. That is what the following information is all about. We strongly urge you to pay close attention and to review the procedures often enough to keep it committed to memory. We've provided a summary at the end of this tape for you to discuss with your friends and family members. We've also listed the essential items you should keep on hand in case of an emergency.
Broken bones.
I'm Dr. Dennis Wyman. I've been a practicing emergency specialist for the past 15 years. During that time, I've had the opportunity to treat thousands of fractures. A fracture is a crack or break in a bone. Basically, there are two types of fractures you may have to deal with.
In a closed fracture, The broken bone does not come through the skin. Usually, the skin is not broken near the fracture. In the case of an open fracture, there is an open wound that extends to the bone, or parts of the broken bone may stick out. This is also known as a compound fracture. An open break is usually more serious because of severe bleeding and the greater possibility of infection. The immediate symptoms of a fracture may include the initial sound of a bone snapping. Regardless if a snap is heard or not, the victim will experience pain in the area affected. Simply touching the area will bring a new wave of pain to the victim. There will be difficulty in moving the injured part, though the bone can still be broken even if the victim can move normally. It may also force the injured part to move in a way that is unusual to normal activity. The victim may experience a grating sensation of bone ends rubbing together. The area may also swell or appear deformed in some way. Another symptom of a fracture is a difference in length or shape of the bone from that of a matching bone. And finally, a bluish discoloration may cover the injured area.
While the majority of fractures treated are non-life-threatening, it's important to remember that you should always treat a broken bone immediately.
Is it okay? How is your arm? Does it hurt? Is there any bleeding? No, okay. No bones? I don't see any bones coming out. Okay, let's get a splint on it right away.
As with any medical emergency, always be sure to ask the victim if they are all right. If they are unconscious, you should ensure an open airway by tilting the victim's head back and checking for any obstructions. Then, if necessary, follow the procedures for the ABCs of resuscitation, which we will cover later. You will want to stop any severe bleeding by applying direct pressure to the wound. If the victim has an open break, cut any clothing away from the wound. If it's an open fracture, do not attempt to push back any part of the bone that is sticking out. Do not wash the wound or insert anything, including medication, into it. Cover the entire wound, including the protruding bone, with a bandage. Next, a splint should be applied. Splinting an open break is the same as with a closed fracture. A splint is used to keep an injured part from moving. Splints also ease pain and prevent the break from becoming any worse. Objects that can be used for splinting include boards, straight sticks, brooms, rolled newspapers or magazines, pillows, rolled blankets or umbrellas. The splint should extend beyond both the joint above and the joint below the broken bone. Padding, such as towels, blanket, or newspapers, should be placed between the splint and the skin of the injured part. Splints can be tied in place with neckties, pieces of cloth, belts, string, rope, or any other suitable material. Do not tie the splint so tightly that the ties interfere with the victim's circulation. Swelling or bluish discoloration in the fingers or toes may indicate that the splint is too tight. The splint should also be loosened if the victim experiences any numbness or tingling in their limbs. After the splint has been applied, you should call for medical help immediately. If the victim has experienced a neck or spinal injury, they should not be moved without the support of a neck or backboard. Any movement of the head can cause paralysis or death if a neck injury has occurred. Always treat the victim cautiously and never give them anything to eat or drink prior to professional medical treatment. Bleeding.
Okay, let's get the patient upstairs, please. When dealing with bleeding from a cut or other external injury, the most important thing to remember is pressure.
To stop the bleeding, place a thick sterile compress directly over the entire wound. Press down firmly on the wound with the palm of your hand. Continue to apply steady pressure on the wound until the bleeding stops. If the blood soaks through the dressing, do not remove it. Simply apply another dressing and continue to apply pressure. Continue applying pressure until the bleeding subsides. If the wound is serious, be sure and call for medical assistance as soon as the bleeding has been attended to. poisoning.
My name is Dr. Steve Mimnaugh. During the years of my practice, I've treated many cases of poisoning. In most homes, a poisoning is an accident just waiting to happen. To minimize the chances of someone in your home becoming the victim of a poisoning, we recommend that you follow a few preventive tips. Be sure to keep child-proof caps on all medication, and also be sure to keep the phone number for your local poison control center posted by your phone. When faced with a poisoning, your first step should always be to call your poison control center. When calling, be prepared to give the following information:
The sex and age of the victim. The name of the poison ingested, if known. Tell the operator how much of the poison was swallowed, if known. Be sure to divulge if the victim has vomited or not. And finally, give them an estimate on how far it is to the nearest hospital. To treat a victim of poisoning, follow the directions given to you by the Poison Control Center. If that service is not available in your area, you must first dilute the poison with milk or water. Do not give the victim fruit juice or vinegar for dilution. Next, induce vomiting by giving the patient 1 tablespoon of syrup of ipecac if it's a child, or 2 tablespoons if an adult. If syrup of ipecac is not available, induce vomiting by tickling the back of the victim's throat with your finger or a spoon. Once vomiting occurs, keep the victim's face down with the head lower than the rest of their body so that they will not choke on their own vomit. If you are dealing with a small child, place them face down across your knees. Then seek immediate medical attention. Be sure and take any remaining portions of the substance swallowed with you to the hospital.
Dealing with the victim of poisoning requires different actions if the patient has swallowed a product containing acid or alkali.
You will not want to induce vomiting. Strong acids and alkalis, if vomited, may cause further damage to the throat and esophagus. Petroleum products, if vomited, can be drawn into the lungs and cause a chemical pneumonia. Give the victim water only and call for emergency medical assistance at once. Choking.
My name is Dr. Dawn King, and I am a practicing emergency physician. One of the most common medical emergencies that occurs at home is choking. To identify a victim of choking, look for the danger signs.
The victim may begin to gasp or breathe noisily. They may begin to grasp their throat. The victim will be unable to respond to you. They may begin coughing to the point where their breathing may stop. The victim's skin color may change to a pale white, gray, or blue color. And finally, the choking victim will begin to panic.
If you suspect someone is suffering from choking, the first thing you should do is ask if they are all right. If the victim can speak, then air is still moving through their airway. In this instance, you should not do anything. Simply allow the victim to cough the item out by themselves.
You okay, honey? Michelle? Michelle, you choking?
If the victim cannot breathe or gives the international sign for choking, both hands on the neck, you should immediately begin to perform the Heimlich maneuver. To begin the Heimlich, stand behind the victim and place your fist with the thumb side against the victim's stomach, slightly above the navel and below the ribs and breastbone. Hold your fist with your other hand and give 4 quick, forceful upward thrusts. This maneuver increases pressure in the abdomen, which pushes up the diaphragm. This, in turn, increases the air pressure in the lungs and will often force the object from the windpipe. Do not squeeze on the ribs with your arms. It may be necessary to repeat the Heimlich maneuver 6 to 10 times. If the victim is lying down, turn them onto their back. Straddle the victim and put the heel of your hand on the victim's stomach, slightly above the navel and below the ribs. Put your free hand on top of your other hand to provide additional force. Then give 4 quick thrusts. If the need arises to perform the Heimlich maneuver on an infant, the first thing you'll need to do is to place the infant face down across your forearm with his or her head low. Support the head by firmly holding the jaw. Rest your forearm on your thigh. Give 4 forceful back blows with the heel of your hand between the infant's shoulder blades. The blows should be far more gentle than those for an adult. If unsuccessful, turn the infant over and give 4 quick thrusts on an imaginary line joining the nipples, pushing downward and forward. Once again, thrusts should be far more gentle than those for an adult. If necessary, repeat both procedures. In the event you are alone and begin choking, you can perform the Heimlich maneuver upon yourself. First, place your fist on your stomach, slightly above your navel and below your ribs. Place your other hand on top of it. Give yourself 4 quick, forceful upward thrusts. If this procedure does not work, press your stomach forcefully over a chair, table, sink, or railing, and repeat the 4 thrusts.
Burns.
Sooner or later, just about everyone suffers from some kind of burn, whether it's from a result of fire, exposure to sunlight, or from hot substances. Burns are classified according to the degree of the injury.
First-degree burns are the least dangerous because they result in injury only to the outside layer of skin. Brief contact with hot objects, hot water, or steam, as well as sunburn, are the most common causes of first-degree burns. A second-degree burn is one that causes injury to the layers of skin below the surface of the body. Contact with very hot liquids, flash burns, and deep sunburn are some common examples of second-degree burns. Finally, a burn that destroys all the layers of skin below the surface of the skin is classified as a third-degree burn. Electrical burns, fire, and prolonged contact with extreme hot substances are what causes third-degree burns. The obvious symptoms of a first-degree burn are a redness color to the skin. Some mild swelling of the infected area is common. There will be a certain amount of pain and discomfort felt. And finally, a first-degree burn is characterized by unbroken skin without blisters. Once a first-degree burn occurs, the victim needs to place their hand under cold water immediately. If that's not possible, then apply a cold water compress, such as a washcloth or towel soaked in cold water, on the affected area. Remember, if water is not available, any cold liquid can be used. The purpose in doing so is to decrease the temperature of the burned skin as quickly as possible, thereby limiting any tissue damage. Then, cover the burn with non-fluffy, sterile, or clean bandages.
It is important to always remember that you never want to put any butter or grease on a burn. These will only cause blistering and infection. For a burn to heal, it needs air.
The symptoms of a second-degree burn are a redness, or blotchy or streaky appearance of burn. A second-degree burn will usually be accompanied by blisters in the burned area. There may be a moist, oozy appearance to the surface of the skin. A victim of a second-degree burn will experience pain and a swelling of that area that may last for several days. In the event of a second-degree burn, place the victim's burn under cold running water until the pain diminishes. Then, gently pat the area dry with a clean towel or other soft material. Cover the burn with a dry, non-fluffy, sterile bandage or clean cloth. This will help to prevent any infection. If the victim has suffered burns to his or her legs or arms, then they should be elevated once bandaged.
The victim of a second-degree burn should always seek medical attention as a follow-up to home treatment. If the victim has flash burns around the lips or nose, breathing problems may develop. In this case, the victim needs immediate medical attention. They should be taken to the nearest hospital emergency room as soon as they are stabilized. Once again, do not apply butter or oil to the burned area. Also remember to not attempt to break any blisters that may appear.
The characteristics of a third-degree burn will include a white or charred appearance on the burned area and an obvious destruction of the skin. There usually is little pain associated with a third-degree burn because the nerve endings have been destroyed. In dealing with third-degree burns, it's imperative that a few basic warnings be followed. First, do not attempt to remove any clothing that may be stuck to the burn. Secondly, do not apply ice or ice water to a third-degree burn. This can work to intensify the shock reaction to the burn. Never apply any ointments or sprays to a third-degree burn.
If the victim is on fire, work to extinguish the fire immediately. Follow the simple directions: stop, drop, and roll. Smother the flames with a blanket, rug, or coat. Victims of third-degree burns can experience breathing difficulties, especially with burns around the face and neck. Be sure to confirm that the victim is breathing. Next, if the burns are to the face, hands, or feet, you want to put cool, not cold water or a cloth on the area. Cover the burned area with a thick, sterile, non-fluffy dressing. After dressing the wound, call for an ambulance immediately, regardless of the size of the burn. Anyone with a third-degree burn needs medical attention.
In the event that you are faced with a chemical burn, follow these 5 steps. First, flush the burned area with large amounts of running water for at least 5 minutes. Speed and quantity of water are both essential ingredients to combating a chemical burn. Next, while still flushing the burn, remove any clothing that may be interfering with the treatment. After flushing, follow the directions on the product for treatment. Manufacturers are mandated by law to include such directions on their packaging. Cover the burn with a sterile, non-fluffy dressing. Finally, call for an ambulance or other emergency medical attention.
While accidental burns are a common medical emergency, treating them quickly and correctly can greatly minimize their damage.
Drowning.
You don't need to have a swimming pool in your backyard to be concerned about drowning. In fact, a majority of emergency room admissions for drowning are a direct result of a mishap in a bathtub. That's why I strongly recommend you never leave a child under the age of 5 alone in a bathtub. That's just asking for an accident to happen. When treating a victim of drowning, the first thing that you must establish is whether the victim is breathing or not. If the victim is not breathing, then artificial breathing must be started at once. Lay the patient on their back on a flat surface. Don't waste time trying to drain water from the victim's lungs. Instead, begin mouth-to-mouth resuscitation and CPR if necessary. As always, begin by checking for a clear airway. Then tilt the victim's head back and place your other hand under the chin. Then begin mouth-to-mouth resuscitation, as we will describe later. Once the victim is breathing, call for emergency medical help. If the victim is conscious and breathing, then simply place the victim on their side. This position prevents the victim from choking on any fluids. Once all the water has been expelled, keep the victim comfortably warm and continue to reassure them. Seek medical attention immediately and do not give the victim food or water.
Stings and bites.
Insect stings cause more deaths per year than do snake bites. The most common stinging insects are honeybees, hornets, wasps, yellow jackets, bumblebees, and fire ants.
Noticeable symptoms of an insect sting or bite are an initial bolt of pain associated with the actual sting or bite, localized swelling in the area bitten or stung. A slight redness may develop over the area, accompanied with an itching sensation. And finally, the victim may experience some burning in the affected area. The majority of these symptoms will occur only at the bite site and will usually continue for 48 to 72 hours. When stung by a honeybee or any other insect that leaves a stinger, it's important to remove the stinger as soon as possible. To accomplish this, carefully remove the stinger by gently scraping the skin with a knife blade, card edge, or fingernail. Do not squeeze with tweezers, as this can release more venom into the body. After the stinger has been removed, wash the affected area with soap and water. Then, place ice wrapped in a cloth or a cold compress on the sting area to decrease the swelling and the spread of venom. You should now apply a soothing lotion like calamine or a paste of baking soda on the wound. This should greatly reduce the accompanying pain. Finally, an antihistamine may be taken to ease the symptoms.
While insect stings are for the most part harmless, they can be life-threatening if the victim experiences an allergic reaction. Allergic reactions often occur if the victim has been stung or bitten previously.
The symptoms of an allergic reaction to a sting or bite are severe swelling in other areas such as the lips, tongue, eyes, and mouth, the appearance of hives or rashes on the body. The victim may experience coughing or wheezing attacks periodically. They may also suffer from severe itching over various parts of their body. A difficulty in breathing and accompanying stomach cramps may also affect the patient, followed by nausea and vomiting. The victim may feel weak or extremely anxious. They may also experience dizziness. A bluish color to the skin may develop. You should also prepare for a possible collapse of the victim, resulting in unconsciousness.
To treat an allergic reaction, first make sure that the victim is breathing. If they are unconscious, follow the ABCs of resuscitation. Then, if the victim was stung by a honeybee, carefully remove the stinger.
It is highly recommended that anyone who is known to be allergic to insect bites carry an emergency sting kit with them at all times. These are especially designed to save a life should a bite cause a severe allergic reaction. If you believe this applies to you, you should discuss such a kit with your doctor. Resuscitation.
Hello, my name is David Tate, and I am an emergency medical technician. I have been an EMT for the past 11 years and have responded to every kind of medical. One of the most important medicals is that of cardiac arrest. The life-saving CPR techniques that you're about to learn one day could save a life. One of the most important methods for saving a life is through the use of mouth-to-mouth resuscitation and cardiopulmonary resuscitation, or CPR. These techniques allow you to perform manually the involuntary actions of the heart and lungs that provide the vital blood and oxygen to all the parts of the body. This maneuver is used to treat the victims of heart attack, drowning, or in any case where the victim has stopped breathing. Remember, the following demonstration is not intended to take the place of a certified class in CPR, but is simply designed to give the viewer the basics to performing this procedure. I strongly recommend that each and every viewer take the time to attend a certified course. Before we begin, it is important that we cover the ABCs of resuscitation. In beginning CPR, we learn our ABCs. We like to go AA, BB, CC. The first A will stand for arousal. We need to find out if our patient is either sleeping or if they really need medical attention. So we can come up to our patient, we can gently shake this person, and basically we can yell at our patient to see if they are conscious and alert. If they are not at this time, we can reach down to our patient's head and simply put our fingers at the chin and our hand on the forehead and tip the patient's head back. Now we've opened up the airway. When we go unconscious, our muscles relax. Our tongue is a muscle and it relaxes also. When it relaxes, it falls to the back of the throat. When we open up the airway, it stretches out the tongue and we open up the airway, and we are maintaining the airway with our hands on the forehead and our fingers at the chin. At this point, we can look, listen, and feel to see if this patient is breathing. We can look down the chest. We can feel and hear within our ear if this patient is breathing. If they are not breathing at this time, we need to go to the B. We've checked for the breathing. Now we need to breathe for this patient. This patient will need 2 breaths to begin with. We simply pinch the nose and 2 breaths that take 1 to 1.5 seconds. And in between the breaths, we remove our fingers from their nose so the breath can be exhaled out. At this point, there is still no breathing. We need to check for circulation. We find the middle of their throat or their Adam's apple, then we slide off to either side of the patient. There, we don't press too hard or we don't press lightly. Everyone has a pulse, unless they are in need of CPR. We feel for approximately 7 seconds to see if there is a pulse. If there is not a pulse at this time, we need to yell for help. Hopefully somebody is in our home that can assist us in CPR by making a telephone call of 911 or the other local telephone numbers that are needed. At this point, we need to be skin-on-skin contact. We need to rip the buttons away, cut the buttons, lift up, whatever it is, so we can be skin-to-skin contact on this patient. Also, we need to find our landmarks. We find the ribs and we just slide up our fingers up to the notch in our chest. We put one finger and the next finger to it. Then we put the palm of our hand next to those two fingers with our fingers straight out. Then the other hand is directly over it, and we are directly above the patient, and we can push straight down upon our patient. And when we push down and we release, we never lose contact between our palm or our hand. So again, we find our landmarks, put one finger in the notch, one more finger, palm of our hand, other hand on top, kneel straight up, and we can begin doing the compressions. Compressions are 15 times. And it's 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9, 10, 11, 12, 13, 14, 15. We come to our patient's head, we tip it back, pinch the nostril, and 2 breaths. We come back, we find our landmarks again, put the palm of our hand, one hand on top of it again, and it's 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9, 10, 11, 12, 13, 14, 15. Again, 2 more breaths. Find our landmarks again. The hand and the hand, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9, 10, 11, 12, 13, 14, 15. 2 more breaths. Landmarks again. This will be the 4th time. 1 and 2 and 3 and 4 and 5 and 6 and 7, 8, 9, 10, 11, 12, 13, 14, 15. At the end of the 2 breaths, it's very important that we'll be able to go and make an emergency telephone call if no one has come to help you. It's important that this help comes. It's most important that you begin CPR and you continue doing CPR. That's where lives are saved. But the chances of recovery are even higher if the professional help comes. So we continue doing CPR until we are too tired, or the professional help comes, or if this patient has regained consciousness, the heart beating, and their breathing. Now, if they do vomit, it is also very important that we just simply tip the head to the side, sweep it out, turn your head back, and wipe it off, and continue doing CPR. Again, this is important. You could help save a life.
Roadside first aid.
One of the most likely emergencies you could face is that involving a car accident. Once again, avoid the tendency to panic by utilizing ACT. First, assess the situation. Are there other people on the scene? If there are, your help is probably not needed. In fact, by stopping, you may hinder professional assistance. But if you are the only person on the scene, assess the immediate danger to the victim. If the car is in danger of catching fire or moving in any way, then you should carefully move the victim to safety. If the victim is unconscious, check to make sure they are breathing. If they're not breathing, you should begin resuscitation at once. Once you are sure the victim is breathing, check the patient for any bleeding or other signs of injury. After this, you should cover the victim with a blanket or coat. Anytime you're dealing with an accident in the cold, you'll need to cover the victim with warm clothing or blankets to prevent hypothermia. Then, seek professional help at once. After help has been sent for, return to the victim and help to reassure them that everything is going to be all right. This will help reduce the chance of shock. This is also a good time to secure the accident scene with road flares or emergency markers. To be prepared for a roadside accident, every car owner should carry the following: a blanket or tarp, a first aid kit containing bandages, splints, and tape, a supply of fresh water, and finally, a flashlight and supply of emergency flares.
The following questions are designed to help evaluate your comprehension of the material covered. You may want to get a pencil and paper ready to write down your answers. If 10% or more is missed, you should review this tape as soon as possible. Question number 1. What does ACT stand for in regards to emergency situations? A stands for assess, which is the first thing you should do in any emergency situation. C is for call for help, which you should always do immediately after assessing the victim's situation. T is for treatment, which you should begin, if necessary, as soon as help has been called. Name the two types of fractures. The two types of common fractures are open, where the bone is visible, and closed, where the break remains under the skin. Name 3 items that can be used for a splint. Objects that can be used for splinting include boards, straight sticks, brooms, rolled newspapers or magazines, pillows, rolled blankets or umbrellas. What is the chosen treatment for external bleeding? Constant direct pressure is usually all that is necessary to stop external bleeding. What is the first thing you should do when confronted with a poisoning? You should immediately call your local poison control center and follow their directions. What is the universal sign for choking? To give the choking sign, clasp both hands around your neck. True or false, you should always apply butter or oil on a burn. False, you should never put butter or oil on a burn. When faced with a victim of drowning, what should you first do? You should immediately check to see if the patient is breathing. If they are not, start resuscitation at once. What are the ABCs to resuscitation? A is for airway, B is for breathing, and C is for circulation. Name at least 2 items that should be kept in your car for emergencies. To be prepared, you should keep a blanket, fresh water, a first aid kit, and a flashlight and some flares at the ready. Name at least 3 ways you can make your home a more safe place to live. To make your home safe, be sure to keep child-proof caps on all medication. Keep the number for your local poison control center posted by your phone. Keep a stocked first aid kit ready. Make your tubs and showers safer by using safety grips. Keep all cleansers, tools, and knives out of the reach of children. List at least 3 items that you should always have at the ready. Some of the emergency items recommended are the number of the local poison control center, posted by the phone, a bottle of syrup of Ipecac to induce vomiting in case of poisoning, a well-stocked first aid kit, a copy of your family's member's medical history, including any drugs that they are allergic to, a mild pain reliever like aspirin or ibuprofen, and finally, a working flashlight. Use this list as a beginning to a safer home.